Look for what is a non-negotiable. Like the idea that my daughter would see this whole thing collapsing was a negotiable. The idea that Janet herself would see me collapsing was a negotiable, however bleak it looked. So you find people you had shared a smile with, people you had done a little favor for, people you had given a kind word, people you had listened to, people you had helped along the path in your life are really the ones who came through. I liked that they, by being strangers or third line, so it's not immediate families or whatever, had a very unbiased opinion. The challenge with family is that because they have been with you from day one, they have opinions and sometimes judgment. Sometimes, I remember there's a friend I last saw 15 years ago, and he would just come home and sit there and not talk or panic or say that. And he joined me in the calm. You do know, people who are close to you it'll be awkward because they are hurting as much as you. This one is hurting, but there is some emotional distance. So for me, the support system was all the people we had walked through our lives. Chemo is horrific. That's literally like a summary to it, actually. Chemo is one of the most horrific things to see somebody go through. When she started hers, her eyes turned bloodshot before they find the right mix. Her eyes turned bloodshot. She had splitting headaches. She would vomit. She changed color. She didn't lose as much hair at the time. Lost diet, lost weight, was in extreme pain. It's really, really something painful to see somebody go through, and to understand that that is what is supposed to be curing them is even beats all logic for you at the time. I'm very glad that there are technologies and treatments coming out now where people are actually able to continue and move on. And the previous regimens, the previous chemos, the previous radiotherapies were extremely painful, and we are now getting more to targeted therapies. Recurrence, yes, it's coming back. That's hard because it's like you're just out of the woods and then you're thrown right back into the forest. The most difficult part about Janet's case was that hers was caught really too late, even in the beginning, for reasons which I mentioned earlier. And it's because by the time we were catching it, it was in 5 places. So even when we were able to cure it, the body really had it lacking all around and a lot of faith. But I can tell you, for somebody who was supposed to do 3 to maximum of 6 months on support, who did almost 2 years, we thank for that. And it's more planning for it. So we also spend a lot of time planning for what if it comes back, how do we stop it from coming back? And luckily by the time we finished putting our plans in the place, it was already here. Again, I was saying, coping with death for me is a strange word because you never really cope. It never really goes away. Even if, and people I've talked to who've been in this longer than me, tell me it's still there. In the beginning, it's surreal. It's like an old movie you watched a long time, but all the details are very, very vivid and very clear to you. You first go through a cycle of questioning the why. Then you start hoping they found peace. Then you realize they found peace. Then you slowly start trying to find peace. It's don't run away from it. The lapses and the bad days. There are good days and bad days, and don't anticipate that there'll never be bad days or that one day you say, okay, now I've dealt with it, because it never ends. So you just know it will keep coming. For the kids are different. My daughter was 4, my son was 7. My son was 7 means he was coherent enough to understand. And he was also extremely close to the mother. So for him, he just numbed up. What I've done is we don't cushion the child. Her effects, her pictures, her videos, whatever, are still all over the house. And also very important for me, I've kept the routine. So the routine they had before she passed on has been continued. The way they wake up, as they go to school, the way they come home, the way they do homework. Maybe where she was doing stuff, I now step in, which is quite an adjustment. Then routine and support system. And my biggest advice to family and relatives is not to panic, because panic is infectious. And however much you see the worst, it does not help the caregiver when you express the same panic, because they are also not so sure. 3, judgment. The easiest thing to do is to judge when you're outside, and when you're viewing things. I personally know the pain of a caregiver or even the reaction is very, very hard to understand if you're not going through it.